Greetings, this is Timothy from iMedical Apps. I'm one of the editors here. Today what I would like to do is talk to you about a product we reviewed a few months ago. It's called HANDI, and it's brought to you by CounterMind in conjunction with the Denver Public Health System. What HANDI has created is, along with their Me mobile app solutions, that centers around using our mobile devices and creating a mobile app to help streamline basically the workflow. And what they did is last year, as noted in the CDC blog, is they managed to vaccinate over 2,000 patients in a week. That's quite an impressive feat, and the thing that for most people that are familiar with doing a vaccination, especially in outreach in the community, is it's time-consuming in one respect, but in another respect, there is a lot of information that gets processed. So how does one work? When you think about it, you got to register. You have to take down simple demographic information from a patient. Then you have to go through a questionnaire just to make sure that they can have a vaccination. Do you have an egg allergy? Do you have any contraindications for not receiving a vaccination? Following that, then you actually have to get vaccinated, and you have to record the lot number and the drug that was utilized by either the pharmacist, the nurse, or whoever conducted the vaccination. So right there, you do this, you go back to your office, you got to crunch all this number and put into a database. That's really time consuming, as I mentioned. So what CounterMind created is HANDI. And so how it works is there's a sled attached to this device. As you can see, it's thicker than your normal iTouch 3. But what happens is there's a scanner on it, a barcode scanner, and then there's also the ability to swipe for, let's say, driver's license. So to get to the point, how does this work? Well, when you register, all you have to do is you launch this app up. And it can either be people who are involved with this outreach or this program. And so let's suppose I came up and I have my identification. So here I have my driver's license. The app opens and you would then slide it. You hear it goes off. All the information is down here. My first name, my demographics, where I'm located, my address, gender. It's all in. You can also input insurance information if needed. Now, the key thing to remember is that this is AES encrypted, so for HIPAA compliance and for information, you don't really have to worry about it. So the information is stored to the device, and so the person gets their information entered in. They get a barcode spit out in a printer that they can then utilize, and no further paperwork going on. It's all being collected here. So let's suppose after that, we just completed registration by scanning. Let's go next to, let's say, a questionnaire. So a patient comes up to me, says, I just got registered. Now I'd like to just make sure I can get the shot. So let's go with a barcode. So we have a few sample ones here that CounterMind was kind enough to supply to us. And again, has the ability to scan. So suppose the person is just registered, scan in. Now he's picked up back on here, and he's still in our database. So I can say, are you over 18 years of age? Have you ever had an anaphylactic reaction to eggs? Have you had a past reaction to the flu vaccine? Which are all standard questions that you would normally conduct. So this is all being stored here. Once this is done and you verify the person can receive the vaccination, they finish this stage. So next you would then go to the HANDI portion of the vaccination. So you would go to whoever's going to do the vaccination. Nice part about this is instead of having to record all the lot numbers and everything by hand, you have it recorded here. So let's suppose I'm using Abbott's. I'm using their lot number. And then I can see how much I've injected them with. And that's now all stored here. So we know what we gave that patient. No paper in terms of having to basically with registration collecting. All here. Even if you didn't have a Wi-Fi connection at that site, once you go out and you get back on the Wi-Fi, all the information is now uploaded. And this is what has to be really mentioned is CounterMind's working with the Denver Public Health System on this. So all the information gets uploaded to their database. And that's the key thing, but it is encrypted so it's safe. So where can this be applied? You take me for instance, I'm outside of Boston. As you know, the mayor has just declared public health emergency because a huge amount of flu-like symptoms have appeared. So there's a huge vaccination campaign that just appeared. There's a lot of clinics open, there's a lot of vaccinations going on. This may have been really handy to just have to deal with all that paperwork. But let's go beyond that. Where else can you use it? This may be applied in emergency-like situations where you have people, let's say in Hurricane Sandy, that may require medical care or urgent help in terms of supplies, housing, and such, food. People will most likely have identification. You can use that, you scan them, and you can say what you just did for them. HANDI has, and the CounterMind has taken to another level. They also have a few apps on here going along with the same kind of Me software where they can also call Swipe for Life. And it's the ability to, again, you swipe in, take information, and the person can become an organ donor. We can apply this to a whole bunch of either situations that appear in the community in terms of outreach events, public services, public health. And it's very beneficial because it streamlines the use of technology, reduces the amount of paperwork and work, collection of data that is updated in real time if possible, or at least relatively soon, that others can use in conjunction and verify what's going on. It's a huge time saver. It's using technology to basically help make us better and faster and stronger. And really, I have to say, to CounterMind, you did a very good job. I'm curious to see what Denver Public Health will take this initiative farther and how else they will use it. But again, this is Timothy from iMedical Apps. Thank you for your time and have a good day.